If you're on the journey to conceive and things aren't quite as simple as high school biology class made it sound, you've probably heard about these two power players, Clomid or clomiphene citrate and letrozole, also known as Femara. They are the most common oral medications used to help boost your fertility. But which one is right for you? It's a question we get all the time, and the research is always evolving. We're breaking down the science, the stats, and the side effects to give you the ultimate comparison. Both Clomid and letrozole have the same goal: to trick your body into making more follicle-stimulating hormone FSH and luteinizing hormone LH, which are the key players that get your ovaries to mature and release a high-quality egg. But they go about it in totally different ways. Clomid is the veteran. It's been around for over 50 years. Clomid is like a sneaky lock. It's a selective estrogen receptor modulator, or SERM. It blocks estrogen receptors in your brain. In response, your brain senses this block and thinks, wait, where did all the estrogen go? I need to make more. So, it cranks up the production of FSH and LH to stimulate the ovaries. The only downside is Clomid has a longer half-life, meaning it stays in your system longer. This prolonged anti-estrogen effect can sometimes cause a thinner uterine lining, the endometrium, which is vital for implantation, meaning risk of miscarriage is high. The newcomer. It was originally approved as a breast cancer treatment, but is now widely used off-label for fertility. Letrozole is an aromatase inhibitor. It works by blocking the aromatase enzyme, which is responsible for converting other hormones into estrogen. By reducing the total amount of circulating estrogen, your brain again says, estrogen is low, and boosts FSH and LH production because it clears your system much faster than Clomid. It doesn't have the same prolonged blocking effect on the uterine lining. This often results in a thicker, healthier endometrium for implantation, meaning less risk of miscarriage. For women with polycystic ovary syndrome, PCOS, the research is quite clear. Letrozole is generally more effective. Studies have shown that letrozole can lead to a higher ovulation rate and a higher live birth rate compared to Clomid. For women with PCOS, for example, a major NIH study found a live birth rate of 27.5% for the letrozole group versus 19.1% for the Clomid group. Letrozole is also the preferred next step if you are considered Clomid resistant, meaning Clomid didn't successfully trigger ovulation. On the other hand, for unexplained infertility, the results are much more mixed. Most studies suggest that both medications yield statistically similar pregnancy and live birth rates. A major NIH trial found slightly lower live birth rates for letrozole, 19%, compared to Clomid, 23%, but the difference was not considered statistically significant. With Clomid, there is a chance of more than one pregnancies at the same time, meaning twins or triplets. With letrozole Femara, lower risk of multiple pregnancies due to more frequent single follicle growth because of the lower risk of a thin uterine lining and fewer multiple pregnancies. Letrozole is often the preferred first-line treatment today. Even when both medications show similar effectiveness, it prioritizes the safest outcome: one healthy baby.